In this video I will show you how to extract an upper canine in a large breed dog without breaking a sweat. So if you follow these steps it should be fairly easy, and the vets who think this is a very difficult extractions is typically vets who do not make a large enough flap or remove enough bone. So I'll show you how I do it. So first you use your 15 scalpel to make an incision, a vertical releasing incision between 203 and 204. And then I do my vertical releasing incision distally. So this is called a pedicle flap, where you make two releases. So you can design this flap in different ways, but this is the way I prefer to do it. Also not to remove gingiva from the teeth that are healthy, that are not going to be extracted. So after you make that cut, and you want to make the cut all the way down to the bone, this is very important. Now you take your periosteal elevator and you start at the corner of the flap and you raise this flap. So you want to press the periosteal elevator tightly against the bone and then do like twisting movements, and you kind of peel off the tough attached gingiva. So this is the area where you want to spend a little bit extra time because you don't want to tear the flap. So be a little bit patient here. My best tip is to start at the corner and then move up slightly like this and then walk sideways. So if you release the flap sideways, you will have a lesser risk of penetrating. So you want to make sure that the flap extends all the way past the mucogingival line. The mucogingival line is that line that you see over the tough attached gingiva, between that and the flexible soft mucosa a little bit dorsal to that. That's the mucogingival line. Always make sure that your incision and your release goes past that up into the flexible mucosa. This is extremely important, because if you don't do that, you haven't raised a full mucoperiosteal flap. So you see, I'm quite patient here. I'm working my way slowly forward to get this flap released without penetrating it with my instrument. If it happens and you penetrate it, it happens to me a bunch of times. Don't worry, most often you can put a suture and close that little hole. This is a tricky spot. You want to, in this area, press very firmly against the bone. You want to always have a hand on the patient, and you want to place your index finger very close to the tip of this periosteal elevator. And with twisting, turning movements, while you put hard pressure down to the bone, you can peel off this layer of attached gingiva. This is the part that actually could take more time than extracting the tooth itself, but I want to spend enough time, I want to be patient, so I'm not tearing the flap. This specific type of periosteal elevator is from the company called Dentanomic, and they have a nice shape. They're very sharp, and you get a very strong grip for large breed dogs like this because of the handle. Okay, just the final spot here. This is you see, it's a kind of weak spot, and I have to be careful not to make a hole. So just small increments. This is surgery by the millimeter, and you do. This is a critical spot right here where the gingiva becomes mucosa. You have to carefully twist and turn to pry this off of the bone. Go in from the side, that's more safe. Scrape, keep hard pressure against the bone. Be in control, always rest your hand against the head. So it's small movements, and now it's off. So you can see now I take it off. So you want to scrape off or the attached soft tissue here. So just get rid of all this. There are no big blood vessels in here. Don't worry. We want to expose the bone. So the only thing you should see now is bone. If you see muscle, soft tissue, you have to scrape it more, scrape off like this. And we want to get rid of all this. Now I take a 701L, a surgical length, cross-cut tapered fissure carbide burr. And this burr is made for sectioning teeth, but using it in a sideways action like this, using the whole side of that burr to remove bone. This is something I learned from Brett Beckman, and I've used it for all of my extractions. I think it makes it a lot quicker than using a round burr, because you have the whole side of that burr. You can see I'm removing a bunch of bone at once, but you have to get used to holding the handpiece in a special angle, and sometimes it gets a little difficult, but as with everything, with a little bit of training, this becomes easy over time. So now I'm outlining the root. So you want to remove the bone that's covering that root. And you want to just keep sweeping across until you start to see what is bone and what is root. And now I switched burrs because this was getting a little bit dull. So for a large breed dog, I would say, yes, a burr should only be used once, because you will put a lot of stress on your handpiece if you are using a dull burr, because you have to press harder, and the gears and everything inside that handpiece head will get worn. And replacing a handpiece is much more expensive than just replacing burrs regularly. So you want to go up underneath here, underneath that edge of bone a little bit. Go a little bit under there. Get that whole root exposed. So you can see I'm drilling quite a bit. And don't be afraid of this. This will help you tremendously. Okay, now you make the groove. So you have to make a groove, mesial and distal. So in front and back of that groove, or the root. The groove should be as deep as almost the entire diameter of the tooth. So not mesial to distal, but buccal to palatal. So the grooves are about here, maybe 5-6 millimeters deep. And you should not make the grooves wider than the burr itself, because the purpose of the grooves is exactly what you see here. You have to create a moat that is where you can insert an instrument. It has to be wide enough so you can insert this elevator. But if it's too wide, your elevator cannot fit snugly in there and it will feel loose. So I'm using some different instruments here. This is a Luxating blade from Dentonomic. These are very, very thin and very, very sharp. And I use them primarily on the palatal aspect here. So they are very good at engaging that periodontal ligament space. So you go in and you use it in a cutting motion. Do not twist this blade because it will get bent. But so consider this blade as a strong scalpel. So you can cut your way down like this on the palatal side and move further up apically towards the root tip. So this is how I get that release on the palatal side. I don't expect to go very deep, but if I can get about a centimeter up here on the palatal side, I'll be very happy. So now I'm switching instruments again. I'm going to the larger size Luxating blade. So you start with a very small and then you move your way up. Even in a large breed dog, you can start with a 1.5 millimeter blade just to get some purchase, and then move to a larger and larger size. So this is called luxation. Anything that's not twisting. The twisting motion comes in when you use the elevator, because you're elevating the tooth. Now I'm switching to this is a Luxating elevator, or you can call this is from IM3. This is called stubby handle luxator. They are almost indestructible, but they are very sharp. So I use them when I need to cut, but also be able to twist. Now I switch to a true elevator. This is from IM3. This is a size 5 or 4. This exact spot is quite safe because the bone is very dense right here. So here on that, I want to place it a little bit palatal and mesial. So mesial is the front of the tooth. So now I'm using that bone as a backstop to twist that tooth out of its socket. And you can now see it starting to bleed. That's great because it means that you have torn the periodontal ligaments and they are starting to bleed a little bit. So it's a sign of success. Now I go with an extraction forceps and deliver the tooth. So the drill made most of the work here, and I had to use quite some force with the elevator. But as you see, once you remove all this bone and make the grooves, this extraction becomes quite straightforward. And you can use this video for your next extraction. Just pull it up on your phone while you're doing it to see if you removed enough bone or not. What's the next part? Next part is smoothing down all pointy edges. So there will be some sharp edges here of bone. So I'm using a diamond football burr to do that. Just smooth everything. Use just your finger to feel, is this bone smooth or are there any sharp edges that may irritate my flap? So just smooth and feel with your finger. Does it feel smooth and nice? Yes. Now I trim the inside of the palatal side here. You can use a diamond football burr on the soft tissue. That's the beauty of this burr, that you can even use it to debride epithelium and granulation tissue off of the inside of a flap. So you see, I'm seeing a little bit of oozing of blood here. Don't worry about that. It will stop in a minute. So I'm not spending any time trying to stop this bleeding. We actually want some blood to fill the alveolus before we close, because a nice formed blood clot is the best material for healing that you have. So now I'm going around with my periosteal elevator and releasing the edges 360 degrees around this alveolus. And my hand is a little bit in the way here, but you can see I'm trying to make a little edge here, or ledge, what you call it, raising that 3-4 millimeters of gingiva. And what's the reason of this? Well, it's because you want to have something to suture to. Because if the gingiva is still attached here, you cannot pass a suture through that at a 90-degree angle. I'll show you in a little bit. It's also very important to go right here and release this edge so you have something to put your needle through. And you want to try and have all your sutures rest on a bony surface. So if you make the incision straight over the tooth and remove the tooth, now you have like two curtains that you have to close over a defect. This is not going to work. There's a high risk that will dehisce. So all the sutures should be resting on a surface of bone. That's why you want to make your releasing incisions further away than where you're going to drill bone away. Okay, so make the incisions wider. Make the base of the flap wider than the apex. And now you see how I release it. You lift up and you find that space. You can find it blindly with some scissors between, this is the periosteum that I'm releasing here. So when you cut this part, you have mobilized this flap a lot, and you can cut all the way through if needed, from one end to the other. I'm checking here, I'm not penetrating, so I go through, and this is the periosteum that I'm releasing. You see the scissors coming out here, just like that. Put it in. and then you release. And this is how you release that flap. If you need even more release in case of gingival recession, then I also have a video on YouTube here about, it's called extreme gingival recession, and it will show you how to release the layer beneath. That's the buccinator muscle layer, and if you release that, you will get even more mobility. But this is quite enough. The rule is you want to be able to place the flap over the defect, and it should stay there. If it pulls back, it means that there's tension and you need to release more. Now I'm just trimming the edge because you want a fresh edge to close. That will promote the healing in case there were any granulation tissue, anything here. This tooth did have a fracture. There was it was a crown root fracture, and the owner did not want to go through subgingival restorations and all of this. This was a dead tooth also, by the way, so we would have had to do endodontic treatment also, and it was just too much for this dog and this owner, so we elected to extract it, which is perfectly fine. So place your sutures at the corners first, so you kind of align the flap where it's gonna go. I just sped up the video, so it's 2 times the speed right now. I'm not moving this fast in reality. The suture is a monocryl 40 on a P3 needle and a violet dyed, purple dyed suture. This is very nice because now you can actually see the suture because it's not translucent. So notice how I push in with the forceps. That's because I want to get an entry and an exit of the needle into that flap at a 90-degree angle. See, I'm lifting up, pushing down to make sure it exits at a 90-degree angle. I'm making a surgeon's throw and 3 throws above that. So here, enter that flap, out the other side, double throw, 1, 2, 3 on top of that. And then you just go all the way around. Keep doing it. You want to place your sutures about 3 millimeters apart, and you want to take a bite that is 3 millimeters deep. Leave the ends, leave about 3 or 4 millimeters of suture, because if they are too short, they may actually, the knot may open. I'm using this Heger Olson needle driver with a scissor in it. For the large breed dogs, this works fantastically well in my hands. For the cats, it becomes a little bit too big, and sometimes you need a scissor that can cut the suture instead of the needle holder. Oops, I just pulled through. This happens sometimes. Let's go in. Again. So the part you're finding yourself spending most of your time is managing the flap. So releasing the flap and suturing the flap. The actual drilling and extraction part should be the fastest when you do it in this way. And if you decide to release the flap, you see I'm making like an oblique caudal incision. But you could also include the 205 and 216 and release the gingiva off of these teeth and just put it back and suture. That's also okay. But I prefer to do this because I prefer to keep the gingiva on the teeth that are not getting extracted. Just because when we can do it this way, you will not disrupt that gingiva. But it will still heal So it's okay to do it. There's many ways to roam, and this is just one of them. So now you see here, see, I can grab this edge a little bit and really squeeze this suture in there. If I had not released this part with the periosteal elevator before, I would have had a very hard time getting the needle in. And see, I'm just hitting some vessels here because it's bleeding, some extra. Don't worry about this at all. We like this blood to be there because it will fill the alveolus with a blood clot. What you could do before, if needed, if this is dirty extraction, if there's a periodontitis involved, you want to scrape out this alveolus with your spoon curettes and then flush with saline and then wait for the blood clot to form and then close. If there's no blood forming, then you can use your spoon curette to scrape the bone to make it bleed. If it still doesn't bleed, you can take some blood from the jugular vein, just draw it in a syringe and then put it straight into the alveolus to make your own blood clot. You don't need any bone graft or anything like that, just some blood clot. This is really enough because we're not going to place any implants or anything like that, so this is quite enough. All right, the last suture here is going to be in the mucosa. Here you go. You see it's a little bit bruised in the middle. Don't worry about that. It will heal, and it did heal very nicely. This extraction was quite straightforward, but sometimes you have so much gingival recession that this flap seems impossible to close. I've made a video exactly on that scenario. Just click that suggested video right here to go and watch that immediately.